We haven't gotten to it yet.
Type
Your
2.
secondary, type 2.
Thank you, Leah.
What
Thank
is
you.
happening?
Okay.
It's actually a second degree.
We call this one.
Oh, why is it secondary? Second degree.
Same thing.
For whatever, you're not getting progressively longer. Your PR interval is not getting longer and longer and longer. It's just saying, boom, it's dropping.
Yeah.
So, we have, the book doesn't talk about this. It's probably not, it's not something you need to know right now. But you have a compensatory pause and then a non-compensatory pause. Okay? I said that backwards. This is a non-compensatory pause. This is a compensatory pause. As it's getting longer and longer and longer, it has to compensate. Okay? It's getting, it's, what are you laughing at? Because I can't say that word?
No, I hiccuped.
Yeah. So, did I say that right? Compensatory, non-compensatory. Yes. This is the compensatory because it's different lengths. This is non-compensatory because the lengths are not different. The lengths between here and here should be the same. The lengths between here and here are always, I know that just made it really confusing, but the lengths are always different.
Yeah.
Right? So, there's no compensation here. Okay? We have going on. Here, we call this a clusterfuck.
Cool.
They're fucked, they're in secondary type 2, and it comes in clusters.
So it sometimes can be regular, but sometimes it's irregular?
For the most part, it's probably going to be all over the place.
Okay.
Within reason, you're not going to have an 8 to 7 and then a 2 to 1.
Okay.
You'd have an 8 to 7, 6 to 5, 8 to 7, 7 to 6. They're going to be kind of a reason. It comes in clusters. Okay? Secondary type 2. Now, they're going to say,
And that's who gives a shit.
so Stout asks in class, well, what's the cardiac output? Well, if you were in, right, in a 2 to 1, 2, right, a 2 to 1, well, you're losing 1 QRS for every 2 P waves. So right there, you lost 50% cardiac output. If you had a 3 to 2, for every, that was a bad one. We'll make it up. Well, that was a 4 to 3. That'll mess up the math a little bit, but it's all the same. Whatever. If you had a 4 to 3, you were losing 1 for every 4. So here, what is it? You lost 25% of the cardiac output, right? If it was a 3 to 2, you would lose 66%, right? 2 divided by 3, 3 divided by 4. That's how you know what you lost in cardiac output. Make sense?
Say that again. One more time.
Stout asks, oh, so you have a 2 to 1 third degree or second degree type 2 AV block. What cardiac output did you lose? Well, for every 2 P waves, right, you have 1 QRS. So you lost 50%. 2 to 1, you lost 50% cardiac output. Right off the bat, everything else is perfect. You lost minimum 50% cardiac output. If you had a 4 to 3, which that says 4 to 3, believe it or not, you would have lost 25%. So, because you have 1, 2, 3, 4, 1, 2, 3. 3 divided by 4. So minus 100.
Okay.
That's how the math works. Like 2 to 3, same thing.
Okay.
You lost
Yeah.
1/3 of your cardiac output, or
Just the way that you said it the first time, I was like, wait, what?
I said it wrong. I was
But yeah, okay. So you, the more like if it's a 5 to 4, like the more times that you have a QRS complex for P waves, the better your cardiac output's going to be in comparison to a 2 to 1.
Correct.
Or 3 to 2. So the 4 to 5 would be a lot better than a 2 to 1.
Right. 5 to 4.
Yeah, 5 to 4.
So the question is, what's the maximum amount of cardiac in theory, right? Because other things, blood pressure, sick sinus syndrome, you have a hole in your heart, murmurs, whatever's going on. So in theory, if you have a 2 to 1 or you have any heart block in the world, what is the maximum cardiac output you can lose? 50%, because you can't get, you can't have a 3 to 1. You can't. You're not going to have. I mean, look, maybe you could, you're gonna have a P wave, and then a P wave, and then a P wave, and then a P wave. Oh, we have a QRS, and then a P wave, and 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 a P wave. Oh, now you have a QRS. Okay, maybe you could, but realistically you can't. So the 2 to 1 is really the worst. Make sense?
Yeah.
Cool. All right.
That would look like a school.
We can go back into that room, the bigger room.
I don't think I want to see that.
The recorder's in the
Or erasing the board like that.
This is fine.
Yeah, this is a pain in the ass of erasing this at him.
I like watching him erase it. It gives me
You
entertainment.
like watching me work?
Yeah, I like watching you work. It's like you're being an actual teacher. Pretty great.
All right, class.
Talk about him behind his back
So who threw that? All right. So we have our sinus, right? What
I was gonna throw the book at you.
what are the sinus rhythms?
The,
Normal.
normal sinus rhythm.
Right,
Pretty
what's the rate?
tacky.
What?
What's the rate for normal sinus?
60 to
60
100.
or 100.
Okay. What else? Yeah?
Brady sinus or sinus Brady.
Sinus Brady, right? I get this all the time.
So
I
sinus
draw the
something?
sinus. I draw sinus bradycardia, right? Sinus Brady's fine, but sinus bradycardia. What rhythm says Brady? Brady's a speed. Brady is not a rhythm. Okay. Since we're talking about that,
Particular one.
Lori.
Yes?
Yeah, because turn on, right? Lori, when you have this,
Stop picking on me.
because you've been asking me this all week long.
Oh.
You have this rhythm right here. That should have been a P wave. I don't know how it got lost. It dropped. Right?
Did you give me the answer already?
Lori, you have this right here on your monitor, and you see this. What lead are we in?
Lead 2.
Very good. For lead 2, this is a person, right?
Nailed it.
This is his arms.
I like it.
And he has this big smile on his face because you're taking care of him.
Dough man.
The gingerbread.
Gingerbread man.
Where in lead 2, where are the leads? This is important. Where are the leads placed? So you have this lead, right?
Yes, I forgot one.
You have that lead.
And
You have that lead. Whatever, they're saying we have 3. Let's just say, for shits and giggles, we have 4 today. Okay? If you only had 3, that wouldn't be there. Okay?
It'd be on the, yeah, it's on the left.
Well, whatever, let's say it's there. Okay. So what lead is this?
One.
None. It's a freaking
Electrode.
electrode.
Yay!
So this would
You
be
guys.
right arm, right? So that would be
Left.
Left arm.
left arm.
Right leg.
Or right hip.
No, that would be
I'm sorry, left hip. I thought you were going to the
Left
right
leg.
side first.
right leg. Where is lead 2? This is your primary lead. This is the lead you're going to look at 95% of the time. That's lead 1. This is lead
Is
2.
it, yeah, I'm right on the left leg.
Lead 2,
It's like seagull.
That's where her
That's
heart's
1.
projecting.
2,
Thank you.
3.
You don't understand. I've been.
Oh,
Wow.
Thank
That's
you.
okay.
Leads.
it really is.
Most machines are actually, forget I said that. You have for those monitors, not like defibrillation and stuff like that, for just the monitors, you have positive and negative. Is this positive or negative?
Positive.
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 Lead 1.
Okay. Positive, and then you're wrong.
I'm wrong? Who's wrong?
This is
going on?
this is negative.
Yeah, isn't that like negative?
Yeah, because it's going away.
This is positive.
Yeah.
And the other one.
Run to positive.
Yeah.
You always run to positive. Okay? So negative, positive. I used to say, oh, here's how you remember. Because your clavicle looks like a minus sign. And then I did this one time, and this girl says, your rib looks like a minus sign too. So, you know what? Your clavicle is an F a minus sign, your rib is not. Your rib is something else. So.
Well, and if you want to do it for lead 2, your clavicle point, kind of points
Danny,
down
yeah.
a little bit, but not. But that's just for lead 2. That has nothing to do with anything else.
So does this have to do like the right?
So lead 2
Um,
goes from your right to your
It goes
left.
across your heart, basically.
And that's important because we're measuring
Right.
the depolarization.
So
And that's when you get,
So we
I'm-
want
this
it
is-
really-
what's the white over snow stuff?
okay, so white on the right, this is your white, red on the rib, and then they say smoke over fire. And then, so, when you're, the other way around, you're sitting in the car and you're driving, which side is the gas on?
Right. Isn't it?
And
Yeah.
then the brake is on, the gas is on.
Yeah, it's on the right.
Yes,
Okay,
it's
that's on the
on
right.
the
Rachel
right.
left. You're like,
So-
making this question is shit.
That's the green one.
Yeah.
And then the brake is on this side, so that's the brake, the red. Right? Which doesn't work if you don't know which side the pedals are on, like me.
It's pretty colors.
That's what I did. White on the right, red on the rib, smoke over fire. And then the green one goes where the other ones don't go.
I got a playground question.
Henry, yes.
So when we go, like when he has that thing that
Yes. It's showing 2 electrodes, right? 1 lead. Here's a lead 2. You'll know it's lead 2, because 95% of the time it will be. He's not going to try to trick you. Oh, yeah, we've looked at rhythms in lead 2 and identify this in lead 3. It will look similar, but not the same.
So when do you get like the upside down P wave, and you know, like when do things look?
You're either going to be in a different lead, which 12 leads are not my specialty,
Okay, so that's on
or you could be in a junctional rhythm. We'll do junctional when we do junctional on the book. I don't want to kill you with junctional right now.
Okay, so just know that you're only gonna get like the reversal of on your 12 lead.
Don't ask me which lead.
Junctional
So-
is tomorrow.
No, I thought SVT is tomorrow.
Am I reading the wrong place?
I think it's page like 97 to 136 or something. like that.
Yeah, they talk about junctional pacemakers or junctional.
Alright, we can look at junctional.
What do you want to know?
Now let's keep going.
Bingo. Yeah, well, I gotta go eventually let my dog out.
One lead, lead 2 lead, lead 3 lead. And you have 6 here.
Yes.
You have
About to go?
6 different.
Oh, yeah.
I'm recording it. I'll put it on Facebook.
Because you have lead 1, lead 2.
What time is it?
And then you have like all these.
No.
negatives.
My brain is pounding. I'm not even listening.
All these negatives. All these are negatives.